who have shown your interest regarding the topic, especially because today is who have shown your interest regarding the topic, especially because today is who have shown your interest regarding the topic, especially presumptive assumption here. How about now? Can you all try and identify the people here? Presumptive assumption here. If not all of them, at least many of them, because they're all celebrities and they have made their mark in their own aspects in their lives. But what I'm trying to convey here is that our face is our identity. So as long as we have our face with us, it will speak on our on behalf of us, and it will help us display our identity. So it is in the University of Oxford, they made a study wherein they, or depending upon our lifestyle, they came to a conclusion that on an average, a person crosses over almost 1,000 faces per day, and each face is unique in their own sense. Like no face is identical. Even though monozygotic twins as well, though which is supposed to be considered as identical, still have some characteristic difference in their face, which will make them unique and will carry their identity forward. So, as Sir Thomas Brown rightly says, that it is the common wonder of all men how among so many millions of faces there should be none alike. In short, what I try to convey is, as long as during our lifespan, our face will mark our identity. We really don't have to go and shout out our identity, except in certain unfavorable or unconditional situations, like if a person is in coma, or if it's a child or it's a mentally retarded person, where they seek for identification from other sources. So apart from that, after death, sometimes identity becomes something like customary, especially if we want to decide a final farewell for a person, or sometimes when in the crime investigation situations where the investigation starts or make a beginning by identifying a person. So also in certain situations where the life insurance of a deceased person has to be cleared, or if any other financial situations like in pension, or we have to retrieve the pension of a person, in such situations the person's identity has to be established or has to be revealed. And so also if the partner or the spouse has to move ahead in life, then also we have to declare the identity of the deceased person. More so if a person has gone missing, and then it had this, then we have to identify the deceased person. It becomes important to identify them, especially in order to bring some solace and painful ending to the grieving family. So apart from these customary situations, sometimes there are some situations which makes identification mandatory. Like for example, our country has been hit by almost 431 catastrophes in the last 30 years. Whenever there is any catastrophe, like it can be a natural disaster or a man-made disaster, a whole bunch of or a big there will be a loss of multiple lives which are related to multiple families as such who will be grieving for them. In such situations, identity of the individual becomes important and it becomes mandatory too. And uh, especially if the bodies go unidentified, like in the national scenario, more than 40,000 dead bodies go unidentified, and almost lakhs of people go missing. In such situations, identification becomes a paramount importance. And sometimes identification also becomes important whenever some dead bodies or deceased are unearthed in very unfavorable circumstances, such as a charred body or a dismembered body or even a skeletal, even a body in the skeletal form. In all such situations, identification becomes important. So in forensic language, such identification or where there is an act of establishing the identity of a person is mentioned or regarded, it is termed as personal identification. And as I said, in certain situations, identification becomes very, very important and mandatory. And it becomes challenging too, especially if we don't find any evidence. Most of the times, forensic investigators depend on a comparative form of identification. What I mean to say is, when the usually identification is done by comparative analysis, they take up post-mortem data that is available, which will be usually a radiograph or a fingerprint or any other evidence that they have retrieved, and then they will compare it with their antemortem record, search for them, compare with the antemortem record, and then establish the identity of a person or the deceased. And of course, all the time, DNA analysis has always been considered as the topmost level of identification process. But unfortunately, even the DNA analysis do require an antemortem data to compare. So most of the identification
This meeting is
process
being
that
recorded.
established well is dependent upon the comparative analysis of the postmortem data with the antemortem record. But the problem comes when there is no evidence at all for comparison. That means suddenly, so from incidentally, a skull is unearthed or is found from some region, and there is no clue left in and around the skull, and the investigators have no lead at all, and they have come to a dead end. That is the time when the forensic facial reconstruction procedure will come into picture. It is a procedure which is used when the forensic investigators have no lead at all, and actually there are no evidences and no clues at all to which from where they have to make a beginning or a start. In such situations, they attempt to reconstruct the face over the unknown skull that they have, or unidentified skull that they have retrieved, and then from there on the investigation begins. So at this point of time, facial reconstruction, so it's the process of rebuilding a face onto the representation of an unknown skull. So it's a kind of face is built over the available unknown skull, and then it is made available for the public for identification process. So forensic whenever we talk about facial reconstruction, there is another something very parallel process that runs, and which has to be segregated apart, which is not the same as facial reconstruction. And I want to face it out before digging deep into the reconstruction process, and that is facial superimposition. Why I want to segregate is because facial superimposition is a technique wherein we have some evidence in hand, and based on those evidence, the technique will the application will proceed or progress. Unlike facial reconstruction, where there is no clue at all with the investigators. Now, having said that, facial superimposition is it's a technique wherein when a skull is obtained, they will make an image of the skull, and they try to compare with the images of the antemortem faces of a suspected person, and then they will match the craniometric points that is present on the skull with the cephalometric points that are present on the face. And when they make a perfect match and the correspondences match one another, the morphological features match one another, then they presume that it belongs to the deceased person, and then further go ahead with the investigation. Now, why and how it is different from facial reconstruction is that whenever facial superimposition is attempted, the investigators have some lead or some clue to which the skull belongs to, and they may be having a set of photographs or some a group of people whom they have narrowed down or they have assumed that to be as a suspected deceased, and then they go on matching one to one with the image of the skull to the image of the face by skull face overlays. But that's why, and that's how superimposition is different from reconstruction process, as reconstruction process is a process which is adapted when there is no clue at all, as I said. And even in superimposition, the overlay can be done, or the overlapping can be done manually, or nowadays it can be done digitally as well. And this, if I give an example, it goes very similar to the digital subtraction radiography that we adapt during in our digital softwares that we use for IOPAs. So one of the examples that I can quote where superimposition was efficiently used is the well-known Sheena Bora case, which was in 2015, where the skull of the deceased was discovered, and skull and the skeletal remains were discovered in Raigad district in one of the forests, and investigators somehow after their investigation narrowed down to the suspect, and then they overlaid the face of facial pictures or antemortem facial pictures with the images of the skull. And from there on, the investigation proceeded, and that was the beginning. Although later on they did forensic reconstructions on the skull available, and then further it was confirmed that it belongs to her. Now, having said that, craniofacial superimposition, technically speaking, it is a process where photographs or video shots as well of a missing person are compared with a model of a skull that is found. Okay, unlike craniofacial reconstruction, where it is a process of predicting and recreating. So I am stressing these 2 points. It is prediction and recreation of the entire face of an unknown skull without a priori knowledge. That means we know nothing about the skull of the descendants' true antemortem facial appearance. So we know nothing about the skull, and that's how we begin with, and we reconstruct the entire face on the skull, and then further on the investigation proceeds. So ideally, now over the period, the terminology of using forensic facial reconstruction has been replaced as forensic facial approximation, because at no given point of time by no forensic artist, a face which is 100% matching to the deceased can be created. And that's why it at the most, the best of their efforts and best of their knowledge, they can only create an approximate image of the deceased person, and that's how that's the reason the terminology no more is used as forensic facial reconstruction. Instead, it is replaced as forensic facial approximation, although the very famous terminology still continues to be used in the literature. That's why both are used synonymously or in exchange to one another. Now, to begin with, imagine that a skull is discovered from a skull, unknown skull has been unearthed. Then what happens is, like for example, if I say if this is the skull, and skull has been unearthed, and for that matter, I am using this from last 6 months, and I want to know this belongs to which gentleman, and I am not sure. And then what I do is I just reconstruct soft tissues over the skull, and then I will produce it to the I'll make it up and I'll reconstruct the face or approximate the face over the skull based upon the information that I am retrieving from studying the skull, and the image that is formed or reconstructed is then displayed onto the public. Like it can be earlier days it was in press. Now we have so many social medias, including televisions. In all those places it is displayed, and then probably it will evoke one person, be it a family or a friend or a friend or a family member, or it can be a kith or kin or relative or anybody. If they are able to identify, the investigation begins from that point onwards. So that's the gist of facial reconstruction as such, if I summarize in brief. Now, to begin with, facial reconstruction started as two-dimensional reconstructions, wherein what they used to do is they used to take the photograph of the skull, wherein definite soft tissue pegs, which I will talk about it later. Soft tissue pegs are placed onto the skull. A photograph is made, and then with the help of the information retrieved from the skull, the artist used to sketch a brief outline of the face that would be resembling the skull of the deceased. And after that, after the sketching is done, the sketch was overlaid onto the skull, unknown skull, and then matched with one another. And depending upon how efficient the sketching was done, accordingly the person was to be identified. It used to help in identification. And soon the manual sketching was replaced by computer assisted sketching. However, it was 2D reconstructions. But later on, as the technology progressed, there were the 2D reconstructions or two-dimensional reconstructions, just like we have 2D radiographs, like extraoral radiographs. It was replaced by 3D reconstructions, just like it is just like CT, MRI, and CBCT, which is replacing the technology. So very soon 2D reconstructions were replaced by 3D reconstructions, wherein the entire skull, the soft tissue is developed around the entire skull. So imagine that a skull is, this is how, if you can see, there is a tag here. This is a skull that has been, that is supposed to be requiring an identification. Then what is the process of doing, what is the process of going about this reconstruction? Is that at the beginning, when a skull is retrieved, forensic anthropologists will do a thorough examination of the skull, wherein after examination, at least 3 parameters or 3 vital informations they try to retrieve from the skull, like the age of the deceased. Usually it will be an approximate range, which is ranging from 5 to 10 years. After that, they will definitely identify the gender, which is much easier than identifying the age, and the ancestry. After this, any other additional information the forensic anthropologist can retrieve. For example, based on the teeth, they can assess the social status of the person or their lifestyle, or depending upon the grooves or depending upon the undercuts in the bone, they can even identify the trauma or any other situations that the disease might have undergone. So they will collect a whole bunch of information that is probably that can be retrieved from the skull, and they hand over the information to the forensic artist, who will take the step further from there. So once this information is obtained, then the skull with due care and respect is handled by the forensic artist. Now, the ideal method of holding the skull is just as it is shown in the picture. Though it is very tempting to hold it through the eyes or the nose, usually the skulls that are retrieved are very fragile. So the artist should be very careful in handling, because this is one of the very important evidence in the court of law. So what they do is, the ideal method is to hold it through the foramen magnum and then spread across the base of the skull, the fingers, and any other missing parts that is present in the skull is covered up with the wax or any other material like acrylic, and then duplicate of the skull is made. So at no given point of time, the forensic artist continues their process on the original skull, because, as I said, Firstly, the original skull is very important evidence which will stand in the court of law. Secondly, whenever they have the original skull adjacent to them, then it is easier for them to compare and work with and go along. So, and they will not damage the original, the virgin skull. So they will create a duplicate or a plasticine skull. And just like earlier we were using the cast, they will use the alginate, they will create a skull from there. However, nowadays with the advent of technology such as 3D printing, skulls from 3D printing method can be created. The reprinted skulls are accurate to the level of 0.1 mm from to that of the original skull. So 3D printing is really brought revolutionary changes in creating the duplicate of the skull that is unknown or unidentified. After that, tissue pegs are placed, or if you can see, the tissue pegs are placed all around the face at multiple anatomical points, just like this. I have made it little exaggerated form because it is visible in the computer. So just like this, multiple tissue pegs are placed around the face at different points. Now, how and why these are the pegs placed is simply because these pegs acts as guides around which the tissues are built up. As we can know that the tissues that are present on the skull, the thickness varies from different points. So it is not the same. Otherwise, we would have been looking like a whole big mass of muscle or big mass of fat with no shape on the face. So it is understandable that the thickness of the tissues that are present on the skull varies at different points. So accordingly, the pegs are placed, which will act as a guide for the forensic artist to build up the tissue or the soft tissue over the skull. Now, going little deeper into this part, because this is where my interest is vested. Now, what is this facial soft tissue thickness? Is nothing but it is the thickness that is measured from the skull surface to the skin surface. Okay, and this is the thickness which varies at different points, and this tissue thickness that we obtain will have the information or will encompass both the skin thickness, the fat that is underlying the skin, and as well as the muscles that is overlying the skull. So the thickness that we obtain will be a cumulative thickness of all of these together. Now, as I said, when the tissue thickness, when the pegs are placed, the depth of the pegs or the length of the pegs vary at different sites, as it is seen in the picture. So what happens is how will we decide what level or what length should be there at each anatomical point, especially when the skull is unknown? So how do we go about it? It goes like this. Whenever an anthropologist retrieved or evaluate the skull, as I said earlier, they will evaluate three informations. One is the age, then this gender, and then the ancestry. So depending upon these three parameters, suppose if I take this skull as an example, and I presume that this is a Malaysian skull because I have picked up from here, and looking at the morphoscopic features, I assume or I believe that this skull is of a male and of a middle age, because the teeth are all very good and they are of good condition, not much of attrition seen, and so many other parameters which I evaluated. So based on these, I presume that this is a Malaysian skull of a male in the mid 30s. So taking these parameters, the forensic artist will go into the literature and search for the data that is available, which will data of the facial soft tissue thickness, which is available in the literature. Now, the point is, from where does these data come from? This data come from the various researches that has been carried out so far. Now, the research, the extensive research has been made in relation to forensic facial soft tissue thickness, using different tools. And what I mean to say is, investigators or researchers have established a data set or based on specific population using different tools. And the initial most investigation or the tool that was used was needle puncture method. By needle puncture method, what they did is they took the needles, and they pierced through the cadavers of the face of the cadavers at different anatomical points, and they measured the depth of the tissues. Okay, and using this depth, they created a data set at different points all around the face. Now, one of the first reconstruction, facial reconstruction was done, which was in way back 1895 of Sebastian Bach. He was a German composer. It was done by a Swiss anatomist. He used this method to recognize or to create a data set for thickness and apply the same thing onto the skull of Mr. Sebastian Bach and recreated the face. So one of the initial tools that was used to measure facial soft tissue thickness was needle puncture method. After that, since it is understandable that we will not get enough cadavers to do the measurements, and so also various other disadvantages, many other non-invasive techniques came into existence, like our two-dimensional radiographs like cephalometric, lateral cephalograms, and other three-dimensional imaging techniques like USG, CT, and MRI. So if you go back to the literature and search, there have been facial soft tissue thickness measurements done using almost all of these tools. However, the latest ones that are being the latest tool that are being used is cone beam computed tomography, because as you know, CBCT stands best among all of these for various reasons. As I said, some of the disadvantages that the investigators found why there was evolutionary use of different tools for measuring facial soft tissue thicknesses, as I said, and then they use needle puncture method. The first problem that they encountered is availability of sample. They could not get more than 10 cadavers to establish the data set. So also, since the cadavers are embalmed, the thickness that they obtained were not equivalent, or they were not corresponding to the thickness of the living subjects. So following that, they started using 2D radiographs like lateral cephalograms, wherein they could get the thickness of only the midline structures as it is seen in the picture. Because it is a profile view, we could get the thickness of only the midline anatomical points and could not get on the bilateral. Plus, there is a problem with magnification as well. Then they came out with many 3D imaging modalities, and one of the data set that has been created, which is involving maximum number of as many as 1,000 people is subjects, is using ultrasound, because ultrasound is a non-invasive procedure. However, the problem with ultrasound is whenever a transducer is placed on the tissue, some amount of compression do happen to the tissues, and again there is a possibility that the measurement may vary. So later on they shifted to CT and MRI. Although the CT and MRI are very good investigative tools for taking FSTT measurements, however, one major problem was gravity. Gravity in the sense, in both the techniques, when the technique is done, the patients will be lying in a lying position. So there was a decrease in the thickness that they obtained along the midline, because the patient will be supine, while there will be increase in the thickness measure obtained on the sides, that is especially in the cheek area. So because of all these problems, later on investigators or researchers went into using CBCT. And CBCT, as you all know, it is a technique which is very simple, and and it is less claustrophobic to the patient. Most importantly, the gravity effect that was seen in CT and MRI was eliminated. So, and it is faster, and it solves various other disadvantages that we got from other CT MRI techniques. So in CBCT, when we use, it is possible to using the software is available with the CT, it is possible for us to visualize both the skull as well as the soft tissue simultaneously, which will allow us to do the measurements from the skull to the soft tissues. So along with that, since they give 3D reconstructed images, it is easier for us to mark the points on the skull as well as on the face. So with the help of CBCT, it is possible to analyze or measure the thickness, facial soft tissue thickness at all the points, both median, midline, and bilateral as well. So we will get a set of measurements, and usually the measurements are done at various anatomical landmarks, and it has been differing from researcher to researcher. They have gone from as minimum as 34 points to as maximum as 72 points as well. So at different anatomical points, soft tissue thickness is measured, and then a data set is created like this. So when the data set is created like this, it is done with different populations. Now we have almost 6,000 to 6,000 the facial soft tissue thickness data set of almost 6,000 populations. I mean, different studies are there. So almost all the ancestral group and the specific population, specific countries, it has been established, like Australia, America, Portuguese, almost all of them, Iranian, Pakistanis, and including Indian. So some of the data set that is available for Indian population has come up from one of the earliest was done by Sahani et al. On Northwest Indian population. We also have data set on Gujarati population as well as South Indian population. So what happens, going back to where I was, so using these data set or population group that is available, the landmarks or the soft tissue pegs are placed on the face at different anatomical points of different depths based on the data set that is available, particular to this specific unknown skull. After the landmarks are placed, after depth are placed, then eyeballs are situated inside the socket. So there are specifications how eyeball has to be placed. It should be along the midline, and the iris should not be beyond the tangent drawn from the superior to the inferior orbital margins. So based on all those specifications, eyeball is placed, and then with the help of clay strips, the thickness of the tissues started building up in between these pegs that are placed. So they are built up to such an extent that just 1 millimeter short, up to 1 millimeter short. So why? Because after entire tissue is built up, 1 millimeter is used to lay a single layer of skin over it. So till then the tissues are built up, and then following that, special care is taken on 4 important structures to be built, especially that is the mouth or the lips, and the nose and eyes and the ears. Why? Because it is established that identification is very strong when these structures are created well. So care is taken to construct the lips. Like there are specifications for that as well. For example, the lip width should be at the interpupillary distance or at the canine level. The thickness and the lip position. Usually they attempt to create a closed mouth or closed lip position because until and unless they have greater details about the skull, they prefer to keep the lips closed. After that, they build up nose. When the nose is constructed, the 2 important points that they have to establish is the width of the nose as well as the nose tip, and then tissues around the eyes is built, and then the ears. So once all these are completed, then a thin layer of skin is built or laid over the built up tissues, and the face is complete. So when we get a face like this, it is usually a generic face. What I mean to say generic is that now that face is constructed based on the tissue thickness or the pegs that are placed, which is population dependent. Now, when we take the data, the population will encompass a wide range of people. So whatever values we get, they are all average values. So accordingly, the face that is constructed will give a generic face over which many other details have to be uplifted so that it is easier for identification. So this was the gross explanation about how facial reconstruction progresses, but there are two schools of thought how this is constructed. One of the initial constructions was done by a Russian anthropologist who is Michael Gerasimov, and the technique is named after the technique that he was adapted. It's called as the Russian technique or Russian method of reconstruction. What he did was using the information that is present on the skull, depending upon the pressure exerted by the different muscles on their insertion and on the insertion and the origin. He first constructed all the important muscles, for example, temporalis, masseter, and buccalis, buccinator, as well as some of the important muscles. After that, he went into constructing other orofacial muscles like levator labiae superioris, then zygomaticus major, minor, and then rhizorius and all other muscles. And then finally, he laid the buccal pad of fat and the parotid glands, and then completed the face. So if I can say that this technique, it is also called as a morphoscopic method or an anatomical method, wherein lot of artistic skill is required, because basically it is the focus is on constructing the muscles, and the muscle information is getting retrieved from the skull, and it requires a lot of artistic skills, unlike there are no guidance like pegs. So this type of technique is most often used in archaeological context, where they construct faces of historical significance. The second method was done by Mr. Wilton Marion Krogman, and the technique is called as an American method. That is the method which I was just describing, and it requires less of artistic skills because we have definite guides that are placed all around the skull, and the tissues are just laid over it using thin strips of clay. So this is how, based on the pegs, the tissues are went on building up one over the other, and then the face is completed. So the American method is usually also called as the morphometric method because we have certain measurement guides for constructing the face, and it is also called as tissue depth method. And this technique is most often used in forensic context to identify individuals in the forensic perspective. So apart from this, now, all this while I was explaining about 2D reconstructions, wherein the constructions are made manually by a forensic artist, which has their own limitations. First and foremost limitation is that of time. It is very time consuming, and it also depends upon the artistic skill of the forensic artist. No two artists can create an identical face from the same unknown skull. So it requires a lot of expertise as well. It is slow and it is little expensive. So gradually the 2D reconstructions were getting replaced by 3D reconstruction manual got replaced by computer-based reconstructions, wherein there are two methods like automated system and modeling system. Now, in computer-based reconstructions, more or less same process is going to happen. However, after analysis of the skull, sometimes the forensic artist will take some facial templates that are population specific, that is available in the data set, and they place it over the unknown skull, and then build up the skull, which is called as the automated system. However, when such facial reconstructions happen, the face that came out after computer generated the face, it was matching more closer to the person from whom the template was drawn. So slowly the modeling system, automatic system was replaced by the modeling system. which is very similar to what I had explained earlier with the manual morphometric or American method, wherein the tissue pegs are placed using the software, and then layer by layer muscles are built artificially, and finally there will be an outcome of the face. An output of the face is generated by the computer. Definitely, this will improve the speed because it is computer generated and it is faster when compared to the manual method. And performance is it is more of an objective technique rather than subjective, where less of artistic skills are adopted and there is versatility. It is easier for the forensic artist to manipulate and make subtle changes if required. They don't have to redo everything from the start, just like unlike in manual techniques. So be it automatic or be it a computerized 3D reconstruction or a manual 3D reconstruction, one point is very important required is facial soft tissue thickness data that is available in the literature, and wherein a lot of research has happened. And as I said earlier, almost all the population data sets among all the population have been already established. So they just have to look into the literature, select the appropriate age groups, and then adapt the same thickness data set that is available onto the unknown skull and start rebuilding the soft tissue. So once the 3D reconstruction happens, it is, as I said earlier, it will end up in a generic phase, which is, more or less, they may not give out or striking identity features. So any other extra features that can be added upon is always beneficial. And how do the artists know about it is again going back to the anthropologist. Many a times when they are excavating the skull, it is possible that some tissue may be left behind onto the skull, unless otherwise it is really old skull. Or sometimes they may have some accessories attached, or accessories, they could have found some accessories like an earring or a bracelet or some clothing. More importantly, like it will all give additional information for the forensic artist to add on some additional information onto the built up skull or built up face. So the more features added on to the face, easier it is for identification. So attempts are made, like, if any other added information is obtained to the artist, it is usually added on to this or added on to the recreated or approximated face. So once the face is reconstructed or approximated, the reconstructed face will face two challenges. First is about the accuracy of the reconstructed face, and second is the recognition. So both the features are interdependent, and I can say they are interdependent and they are independent as well. When I say accuracy, the accuracy largely the onus of accuracy largely will rest on the shoulders of forensic artist and the anthropologist. It is like how well the information from the skull is extracted and how well by the anthropologist, and how well the artist will combine these two information, that is the anthropometric information and the tissue that they have reconstructed, and they will match one another. That will end up in giving an accurate reconstructed face. However, the recognition part is largely dependent upon the public. Like, once the face is reconstructed and when it is projected into the public or the social media, sometimes it so happens that even a single small characteristic feature that is built up onto the reconstructed face could be sufficient enough for a family or a friend or a relative to identify the skull and then get back to the forensic investigators or the the investigation. So that's why these two parameters, which are usually assessed by which is usually decides decisive factors for the success of a reconstructed face, are both interdependent and independent as well. So focusing on the accuracy part, suppose if we want, usually how accurate the face is reconstructed is largely useful for improving the technology that is used for reconstruction, and to assess accuracy, and it is mostly associated with the research part of the reconstruction. What I mean to say is, usually the accuracy of the technique is established by doing two important tests, and the articles and the researches are related to that. They do two tests, like primarily they will check resemblance rating. What is meant by resemblance rating is they will have a reconstructed face on one side, and the photograph of the patient. What I mean to say is, in these two pictures, the right hand side, or this one, is the reconstructed face, and this one is the reconstructed image from what we get from the 3D reconstructed image obtained from the CT. And then they will conduct a research and ask the participants to compare and rate how close or how closely they are matching one another in the percentage of 1 to 100. So the closer the matches, or the closer the image, or the closer the 3D reconstructed image is matching to the actual, the better is the technique. And that's how they decide to improvise on the technique used for reconstruction. And the second research that they do is what is called as recognition test, wherein the reconstructed face is shown to the participants with a set of other 5 to 10 faces that is available in the data set, and the participants are asked to match which one the reconstructed face is closely matching to which of the faces that is available, that is provided to them. So this is again another test that is done to test the accuracy of the technique that they have been using. However, as I said, accuracy is at one level and recognition is at the other level. Ultimately, it is the recognition that is going to matter, because if a forensic artist reconstructs the face, she or he will consider it as 100% successful, even if a single individual, a family or a person identifies or is able to identify the reconstructed face. So though whether the image is accurate or inaccurate, immaterial, irrespective of that, if the person is going to match, or if the person is able to identify, then the reconstruction is more or less successful. We can consider it as that way at the field. Okay. However, forensic reconstruction, facial reconstructions have their own challenges to face, like it requires a lot of expertise because the technique is not easy, and it requires training, and it requires some amount of artistic skills and interest as well. So irrespective of whichever method they use, whether they use morphometric, whether they use morphoscopic, or whether they use computerized or manual, in whichever method they try to reconstruct, some amount of training and some amount of interest, it is actually a culmination of science and art, I must say. So some amount of expertise is required and training is required to establish. Again, the technique that they use has to be reproducible. That means if they have to rechange or remodify, or there should be scope for improvement over the reconstructed face. And more importantly, it is the reliability that matters. What I mean to say by reliability is that how much the reconstructed face or facial reconstruction will stand in the court of law. However, unlike superimpositions, craniofacial forensic superimpositions, which has been accepted by the court of law, reconstruction really doesn't require that, simply because the facial reconstruction is done with the sole objective that somebody must identify the unknown skull. Once that is done, then the investigations, forensic investigation, starts from that point onwards. What I mean to say is, once they identify, then further further steps like taking the DNA, matching the DNA, and going other more significant evidences will begin. So reconstruction as such, it is not a evidence, it is only a part in the identification of evidence or in the collection of evidence to identify the individual. Therefore, it should be used in that way itself. Having said that, facial reconstructions are not only used in forensic context,
Yes,
although
Dhoni.
that's what I have spoken so far. It is also used in the archaeological perspective, wherein faces are rebuilt or recreated of from the unknown remains of some ancient important personalities. And one of them, these are some of the examples, and what I interests me more is about the King Richard III of England, because after reconstructing the face, the family member identified that the Richard III had blonde hair and blue eyes. So whatever face were reconstructed, they had to retrieve it back, and then they had to add these components that was identified by the relative, and then reconstructed again. So apart from the archaeological application, reconstructions has also been used in anthropological situations, wherein the skull remains of as old as 5,500-year-old back early Neolithic man's face has been reconstructed to demonstrate the anthropological applications. So also it is used in plastic reconstructive surgeries. How I say is, depending upon the facial soft tissue thickness data set that is obtained, facial tissues which are lost because of trauma or because of extensive surgeries in cosmetic repair. So facial reconstruction find its application in plastic reconstructive surgeries as well. However, a major application has always been towards the forensic interest. Now, having said this, some of the institutes which offer which offer training for facial reconstructions are all across India. Like it is available in Delhi, Mumbai, then Gujarat and Hyderabad, and even in Bangalore, where they offer different levels of certification courses. It can be as simple as a small certificate or diploma or PG diploma. Apart from this, forensic facial reconstructions have been used to some extent, have been used or have been applied in the field by state forensic science laboratories and central forensic laboratory Gujarat as well. So having said this, forensic facial reconstruction, I'll end by saying that forensic facial reconstruction, it merges art and science, advancing with academic and commercial integration. So ongoing technological progress refines the method, and it finally brings some identification to the unknown skull. So thank you all for your attention, and I extend my warm thanks to all the to NIMS University, and as well as the organizing committee, and my special heartfelt gratitude to Sunil sir, because if I would like to recall that sir had been my PhD examiner during my final synopsis presentation. So I just hope I have not disappointed you.
Definitely.
Then I also would like to extend my gratitude to my institution and my dean, who has been so supportive, and Dr. Francis, who has given me support with regards to for so much of information related to forensic medicine, and my colleagues, my HOD, Dr. Preeti, as well as my colleague, Dr. Vijendra. So thank you one and all. I will just end by saying that in the social jungle of human existence, there is no feeling of being alive without a sense of identity. So identity is crucial for each and every one of us during life and even after death. Without identity, there is no existence. Thank you.
Thank you so much, ma'am, for such an informative session. It was really amazing.
I just hope, I was not sure about the time. I just hope I stick to the time.
So we are open for the questionnaire session. Kindly post your queries in the chat box.
Yeah. Muted है, आवाज नहीं आ रही।
Ma'am, there's one query asking that how is this useful to us as clinicians?
As clinicians, depends on, I would you like to elaborate what is the meaning of clinician? If the clinician is a cosmetic surgeon, then definitely in relation to plastic surgeries. If the clinician is a forensic expert, then it's all what I explained so far.
Thank you, ma'am. Ma'am, now I would request you if you can close your PPT, and Dr. Falak, if you can share your PPT.
Yes, ma'am. Thank you so much, ma'am. Kindly accept a token of appreciation from us.
Thank you so much.
So, as we are about to conclude our event, I would like to invite Dr. Sharma sir, Professor in HOD, Department of Oral Medicine and Radiology, to deliver a vote of thanks.
ಆಯ್ತು ಕ್ವಶನ್ ಆನ್ಸರ್ ಆಯ್ತು 1 hour ಮಾತಾಡಿದ್ಲು.
Good afternoon, everyone. I would like to thank everyone for their valuable time, and I extend my heartful thanks to Manasa ma'am for their efforts. We gain a valuable knowledge and insight on the topic of forensic facial reconstruction. I would like to thank our honorable chairman, Dr. Balveer Singh Tomar sir, who has given a great platform to work on. Our principals are Dr. M. K. Sunil sir, all the HODs and faculty members of our NIMS Dental College, my department staff, faculty, Dr. Falak and Dr. Veer Singh. A special thanks to Dr. Nancy Srivastav, convener for this event. And I also thank the management and the IT department of our NIMS University. Thank you. Thank you.
Very nice presentation. Half ಮಾಡಿ.
So, all the participants, you will all get the certificates through mail within 2 to 3 days. Have a good day. Thank you so much, everyone.
Thank you,
Thank
Dr.
you.
Manasa. Thank you,
Thank you,
Dr.
sir.
Manasa.
Thank you very
It's a
much.
wonderful lecture and really interesting. I was keep on listening that. And
Thank you,
thank you
sir.
for your good presentation in the slides.
Thank you very much.
Thank you for accepting our
Thank
invitation.
you very much. Thank you.
Thank
Yeah,
you.
you
Have
too,
a good day.
sir. Happy weekend.
Yeah, thank you.
Sir,